We are your vaccine authority here at Eyewitness News, and each and every day for weeks now, we have been getting answers to the questions that you've been sending us, and we love getting them. So keep sending them our way, because joining us live right now is another expert today. Dr. David Banach is back with us, the head of infection prevention at UConn Health. Dr. Banach, thanks for taking a few minutes again. We appreciate it.
Thank you for having me on.
Well, first up right here, someone wrote us saying, after I get the vaccine, how do I know it's working?
So that's a really good question. We know that a lot of people after their vaccine do get some symptoms, some of that fatigue, maybe even a little bit of low-grade fever, and that's a sign that your body's responding to it. But I often get questions about people who don't get those symptoms. How do we know that they're responding well? I think it's important to know that in the clinical studies, only a percentage of people actually had symptoms, but the response rate in terms of protection was so high, over 95% efficacy. So I think, even if you don't get symptoms afterwards, there still is a very high, very good chance that you're responding. Also, at this point, the CDC doesn't recommend any follow-up testing or anything like that to ensure protection. But, the data tells us that the overwhelming majority of individuals who get these vaccines will be protected.
But after you get your first shot, doctor, I understand, and correct me if I'm wrong, but it slowly starts building your immunity, right? So maybe over the course of a few days, you're in a better position, right?
Exactly. That's a key point. So being fully vaccinated doesn't occur until 2 weeks after your second dose. So if for the Pfizer and the Moderna vaccines, and 2 weeks after the first dose and only dose of the J&J vaccine. So you do need to give your body time to generate those immune protecting cells, those antibodies, to be able to really know that you're at that peak level of immunity and protected. So, for those first 2 weeks, really important that the vaccine doesn't change any of your activities. You still use all the precautions to protect yourself.
Okay. Good point. Thank you very much. Now to Margaret. She wrote us. She wants to know, will taking the vaccines affect pregnancy later on?
So good question. A lot of folks have been asking that, and at this point, there's no scientific basis to suggest that these vaccines would cause infertility. In fact, the American College of Obstetrics and Gynecology, several other professional societies have put out a statement that there is no evidence linking infertility to these vaccines. Granted, they've only been available for a certain amount of time, and the fertility issue wasn't specifically addressed in the studies. But at this point, all of the experts in that area do not view that as being a concern or a contraindication to getting the vaccine.
All right, certainly good to know. We just had a story a few minutes ago about how they're doing some new testing now with children and especially babies as well. So I imagine you'll learn more about that over the months to come.
Absolutely. Yeah, no, we're excited. There's new data that's going to come out on teenagers who have been enrolled in clinical trials for the mRNA vaccine. So we'll get that soon. And now we're starting to look at using these vaccines in younger kids as well. Okay.
Dr. Banach from UConn, thank you very much for joining us again this afternoon. Always good to see you.
Thanks for having me on.